After 60, masturbation changes, and if you don't adapt, it can quietly affect your body, your mind, and even your masculinity in ways most doctors won't tell you straight. I'm Dr. Cheryl Lim, and I've been practicing urology for over 20 years here in Singapore. Today, I'm sharing 5 secrets about masturbation that older men wish they'd known earlier. Trust me, by the end of this video, you'll understand why what you do matters more than you think. Look, I know this topic can feel uncomfortable. In our Asian culture, we don't talk about these things openly, but after 2 decades of seeing patients in my clinic, I can tell you this affects nearly every man over 60. And the silence, that's what's hurting you most. So if you're still watching and you want to know these truths, type the number 1 in the comments below. Let me know you're paying attention. Before we dive in, let me tell you something that might surprise you. Your erection isn't the whole story anymore, and that's not failure, that's evolution. Most men my age, they come into my clinic at Mount Elizabeth or Gleneagles, and the first thing they ask is why things don't work like they used to. They're chasing what they had at 30, 40 years old. But here's what I tell them. Your body is different now. Your hormones are different. Your blood flow is different. Even your brain chemistry has changed. And you know what? That's completely normal. The problem isn't that you've changed. The problem is nobody told you how to work with these changes instead of fighting against them. After treating thousands of men across Singapore, from HDB heartland clinics to private practice, I've seen the same patterns over and over. The men who adapt, they maintain fulfilling intimate lives well into their 70s and 80s. The ones who don't, they struggle unnecessarily. Now you might be thinking, doctor, is it still okay to touch myself at my age? Let me be crystal clear. Yes, absolutely yes. In fact, not touching yourself might cause more damage than you realize, but we'll get to that in secret number 3. First, let me share something from just last month. A 67-year-old uncle came to see me, retired engineer, married for 40 years. He sat in my consultation room and told me something I hear all the time. Doc, I feel like I'm not a man anymore. His voice was so soft, like he was ashamed. But here's the thing, his body wasn't broken. His approach was outdated. And once I explained what I'm about to share with you, everything changed for him. Secret number 1, slow down and stop chasing the finish line. I know. When you were younger, it was all about speed and intensity, right? 5 minutes done, move on with your day. But after 60, your body needs something different. Your nervous system, your circulation, your hormones, they're all operating at a different rhythm now. Think about it like this. When you kopitiam with your friends, do you rush through your kopi and run out? No lah. You sit, you sip slowly, you enjoy the conversation. Your body's the same way now. It wants you to take your time. The research shows that men over 60 who practice slower, more mindful self-touch report higher satisfaction and better erectile function. Not because they're performing better, but because they've learned to appreciate the journey instead of just the destination. One patient told me last year, Doc, when I stopped rushing, I discovered sensations I never knew existed. He's 71 now, and he says his intimate life is better than it was in his 50s. Can you imagine that? Here's what happens when you slow down. Your body produces more nitric oxide, which improves blood flow. Your brain releases more oxytocin, the bonding hormone. Your pelvic floor muscles get proper engagement and relaxation cycles. All of this contributes to better overall sexual health. But most importantly, when you stop chasing what you had at 30 and start exploring what you have now, you open the door to a new kind of intimacy, one based on patience, curiosity, and self-respect. Secret number 2, your brain is your most powerful sexual organ, not what's below. Let me tell you about Howard. Changed his name for privacy. 63 years old, came to my clinic complaining about erectile difficulties. First thing he asked, can prescribe Viagra or not? But when I took his history, you know what I found? He was watching the same type of content he'd been watching since his 30s. Hardcore stuff, very intense, very fast-paced, and his brain had become so wired to that kind of stimulation that normal touch wasn't doing anything for him anymore. This is what we call porn-induced erectile dysfunction, and it's becoming more common in older men. See, your brain is plastic. That means it changes based on what you expose it to repeatedly. If you've spent decades training your brain to respond only to extreme visual stimulation, then real-life intimacy becomes less satisfying. The good news, your brain can be rewired, but it takes time and conscious effort. I told Howard to take a break from all screens for 90 days. No porn, no sexual videos, nothing. Just focus on physical sensation and his own imagination. He thought I was crazy. Doc, 90 days? That's like asking me to stop eating rice? But you know what? He tried it. And after about 6 weeks, he noticed something. His sensitivity was coming back. Real touch started feeling meaningful again. By 3 months, his erectile function had improved significantly without any medication. The science behind this is clear. Excessive porn use, especially the high-speed internet variety we have now, can alter your brain's dopamine pathways. Your pleasure threshold gets higher and higher until normal stimulation can't reach it anymore. But when you reset your system, your brain gradually returns to its natural sensitivity. For men over 60, this is even more important because your dopamine production is already declining naturally with age. You don't need to make it worse by overwhelming your system with artificial hyperstimulation. Secret number 3, use it or lose it is real, but not in the way you think. Okay, here's something most doctors won't tell you directly. Regular sexual activity, whether with a partner or by yourself, is essential for maintaining erectile function as you age. This isn't about performance or proving anything, it's about basic physiology. Your penis needs regular blood flow to stay healthy. Think of it like any other muscle or tissue in your body. If you don't use it, it atrophies. But here's the nuance, it's not about frequency, it's about quality. I had a patient, let's call him Roy, 69 years old. He told me he'd given up on sexual activity entirely after his wife passed away 3 years ago. What's the point? He said, I'm old already. Nobody's interested in an old man like me. But when I examined him, I noticed signs of penile tissue changes that concerned me. Reduced elasticity, some fibrosis starting to develop. These changes can become permanent if left unaddressed. I explained to Roy that regular erections, even without a partner, help oxygenate the penile tissue. They prevent scar tissue formation. They maintain the structural integrity of your erectile chambers. It's not about sex, it's about health maintenance. Roy was skeptical, but he started following my advice. 3 times a week, he practiced mindful self-touch with focus on sensation rather than outcome. 6 months later, his tissue health had improved measurably. And as a bonus, his mood improved too because regular sexual activity boosts testosterone and reduces stress hormones. Here in Singapore, I see so many older men who've just given up on this part of themselves. Maybe their marriage became sexless, maybe they lost their partner, maybe they're just tired, but giving up completely has real health consequences. The research is clear. Men who maintain regular sexual activity, even just through masturbation, have better cardiovascular health, lower rates of prostate problems, and better mental health compared to those who become completely inactive. But remember what I said in secret number 1, this isn't about rushing through it 3 times a week just to tick a box. Quality over quantity, make it meaningful. Secret number 4, your pelvic floor is everything and you've probably been neglecting it. When I mention pelvic floor exercises, most men look at me blur. Doc, that's for women after childbirth, what? But no lah. Your pelvic floor muscles are crucial for erectile function, urinary control, and sexual satisfaction. These are the muscles that control your erections, your ejaculation, and your ability to sustain arousal. After 60, they naturally weaken just like every other muscle in your body. But unlike your biceps or your quads, most men don't even know these muscles exist, let alone how to exercise them. The pelvic floor muscles are like a hammock, supporting everything down there. When they're strong, you have better erectile rigidity, more control over ejaculation, and stronger orgasms. When they're weak, everything suffers. Here's a simple test. Next time you urinate, try to stop the stream midway. Can you do it? How strong is the control? If it's weak or difficult, your pelvic floor needs work. I teach my patients a technique called progressive pelvic floor training. It's not complicated, but it requires consistency. Contract those muscles like you're trying to stop urinating. Hold for 5 seconds, release. Repeat 10 times. Do this 3 times a day. Within a few weeks, most men notice improvements. Better erectile quality, more sensation during arousal. Some even report their orgasms feel more intense than they have in years. One uncle, 72 years old, came back after 2 months of practice and told me, Doc, you're like a magician, SCR. I didn't know things could still work this well. But it's not magic. It's just basic physiology that we never talk about. In Singapore's medical system, we're good at treating acute problems. Heart attack, we fix it fast. Stroke, we respond immediately. But chronic issues like sexual health in aging men, we ignore until it's a crisis. That needs to change. Secret number 5, mind the medication, not just the sensation. This is critical and I see it causing problems all the time in my practice. Many men over 60 are on multiple medications, blood pressure pills, cholesterol medication, diabetes drugs, antidepressants. And guess what? A huge number of these affect sexual function. Beta blockers can reduce erectile capability. SSR is often delay or prevent orgasm. Some diabetes medications affect nerve sensitivity. Diuretics can impact blood flow. The list goes on. But here's what happens. Men notice their sexual function declining and they assume it's just age. They don't connect it to the new medication they started 6 months ago. Or they do notice, but they're too embarrassed to tell their doctor. Last year, I had a patient who'd been struggling for 2 years, completely lost interest in any sexual activity, couldn't achieve erection even with medication. He was convinced his body was done. Turns out, his GP had put him on a high dose of a particular blood pressure medication known to cause these side effects. When we switched to an alternative with fewer sexual side effects, his function returned within a month. 2 years of unnecessary suffering because nobody had the conversation.
So here's what I tell all my patients. If you started a new medication and notice changes in sexual function around the same time, speak up. Don't just accept it. There are often alternatives with fewer sexual side effects. Also, be careful with supplements and traditional medicines. I know many Singaporeans like to take ginseng, honey goatweed, tongkat ali, all these traditional remedies. Some might help, but many can interact with your prescription medications in dangerous ways. I had one patient mixing his heart medication with some supplement he bought at a traditional medicine shop, nearly landed him in A&E with dangerously low blood pressure. Please, if you're going to try anything, tell your doctor first. Now, here's something I want you to understand. This isn't just about physical function. It's about maintaining your sense of self, your vitality, your connection to your own body as you age. In our Asian culture, we have this idea that once you're old, you should just accept decline gracefully, sit back, play checkers at the void deck, wait for grandchildren to visit. But that's nonsense. You're not done, you're not finished. Your body is still capable of pleasure, of sensation, of intimacy. One of my patients, 76 years old, told me something beautiful last month. He said, "Doc, you helped me remember I'm still alive, not just surviving, living." That's what these 5 secrets are really about. Adapting to the natural changes in your body while maintaining the aspects of yourself that matter. Slowing down instead of giving up. Rewiring your brain to appreciate real sensation over artificial stimulation. Maintaining regular activity to preserve function. Strengthening the muscles that matter. And understanding how your medications affect everything. These aren't just tips. They're principles for maintaining dignity, health, and vitality as you age. Now, I know some of you might be thinking, but Dr. Lim, what about my wife? Should I tell her about all this? Look, that's between you and your partner, but I will say this. Many couples over 60 find that open communication about these topics actually brings them closer together. Shame and silence create distance. Honesty and understanding create connection. If you're married or in a relationship, consider having this conversation. Not in the bedroom, not in a moment of frustration, but maybe over dinner or during a quiet evening. Hey, I watched this video and it made me think about some things. Can we talk? You might be surprised. Your partner is probably thinking about similar issues, but also too afraid to bring them up. And if you're single, these principles still apply. Your sexual health is about more than just having a partner. It's about maintaining your physical and mental well-being. Before I finish, let me say this.
After more than 20 years practicing urology in Singapore, I've seen thousands of men struggle with these issues unnecessarily. The shame, the silence, the assumption that decline is inevitable, but it doesn't have to be this way. No, you deserve accurate information. You deserve to understand your own body. You deserve to maintain pleasure and connection throughout your life, regardless of age. If these 5 secrets resonated with you, if you found this information helpful, show me by typing the number 1 in the comments. And if you have questions, ask them. This is important enough to talk about openly. Also, if there's a specific topic you want me to cover in future videos, whether it's about prostate health, urinary issues, or other aspects of men's health as you age, let me know. I read every comment and your questions guide what I discuss next. Remember, aging is inevitable, but suffering is optional. You're still whole. You're still capable of feeling, of touching, of healing, regardless of your age. The key is working with your body's changes instead of fighting against them. Thank you for watching. Take care of yourselves and remember, your health matters at every age.